cases of respiratory illnesses have been surging in northern China, particularly among children. It has sparked speculation of a new pandemic threat 4 years after COVID-19 first emerged in the country. Keeping a firm tab on the developments, the Indian government has initiated a review of the preparedness measures. At least 6 Indian states are on alert: Rajasthan, Karnataka, Gujarat, Uttarakhand, Haryana and Tamil Nadu. Now, the reports of a spike in pneumonia cases in China are similar to early reports of a mystery pneumonia outbreak back in 2019 in Wuhan, which heralded the emergence of COVID-19. And that is why this is creating a scare once again now that we are in 2023. 3 districts of the Indian state of Uttarakhand share land borders with China. The state has directed officials to step up surveillance. The Indian state of Karnataka has also put its healthcare infrastructure on alert. At least 4 other Indian states are also on alert here. Last week, the World Health Organization requested more information from China about children suffering from undiagnosed pneumonia. The WHO repeatedly criticized Beijing for a lack of transparency throughout the COVID pandemic. Some observers speculate the outbreak could be caused by Mycoplasma pneumoniae, commonly known as walking pneumonia. Mycoplasma pneumoniae mostly causes a chest cold. Symptoms include sore throat, fatigue and a slowly worsening cough that can last for weeks or sometimes even months. The prolonged illness and the risk of pneumonia is what's alarming parents. Chinese authorities have attributed the rising cases to the end of COVID restrictions and the arrival of the cold season. The winters are here. They are also citing the circulation of known pathogens, including influenza, respiratory syncytial virus and the virus that causes COVID. Worryingly, it isn't just China. In Europe, the Netherlands is also experiencing a bizarre uptick in pneumonia cases. And again, these pneumonia cases are similar to the ones being seen in northern China, as they are affecting children primarily, marking the second country to report an outbreak of this type. As per reports, the Netherlands Institute for Health Services research stated that 80 of every 100,000 children between ages 5 and 14 suffered pneumonia last week. A news outlet said even the National Institute for Public Health and the Environment, which is essentially the Dutch equivalent of the US CDC, could not give an explanation to this. Beijing's opacity and recent policy measures have added to the alarm. Now, China will temporarily exempt citizens of France, Germany, Italy, Netherlands, Spain and Malaysia from needing visas to visit the world's second largest economy. From the 1st of December to 30th November next year, citizens of those countries entering China for business, tourism, visiting relatives and friends or transiting for no more than 15 days will not need a visa. The move is aimed at boosting post-pandemic tourism. But with concerns over undiagnosed pneumonia outbreak, is Beijing once again looking the other way and endangering the global population?